Health technology, or health tech, is the application of technology, meaning hardware, software, machine learning, artificial intelligence, data analysis, amongst a list of other things to improve the efficacy, outcomes, and the delivery of healthcare. The healthcare sector has seen a significant transformation in the era of technological innovation. It is transforming the delivery of healthcare, enhancing patient outcomes, and raising the overall efficiency and effectiveness of healthcare systems. In Africa, health technology is even more important as it grapples with the highest rates of disease on the planet. The wave of innovation and growth in Africa's health tech is a stitch in time that saves 9. Only this time, it's saving 54 countries, and it couldn't come at a better time. Hello, and welcome to Tech into the Future, where we talk about everything that's happening in technology and how it affects you. My name is Ngozi Madre-Kadozie. I look after Android partnerships for West Africa at Google.
My name is Tumiwa Adikomo. I'm the CEO of Tech Cabal, a digital publication that's been covering African tech for over the last decade. Alongside Ngozi, I will be your guide into the world of tech in Nigeria, Africa, and the world. Welcome back to Tech into the Future on Arise News. We're going to start with the global headlines. Tesla is said to be planning to lay off more than 10% of its global workforce, according to a recent internal memo, which has been made public. As we prepare for the company for our next phase of growth, it is extremely important to look at every aspect of the company for cost reductions and increasing productivity, Tesla CEO Elon Musk said in an internal memo obtained by CNBC. It's a really interesting time for the company. It's facing a lot of challenges from a raft of Chinese competitors. Yep. Its Cybertruck has not really done what it's hoped it would do in the market. And they're supposed to have delivered a low-cost model that just seems to keep getting pushed further and further. Yeah. So interesting times for Tesla.
And to be honest, there's no real surprise there. No offense. Anyway, the next headline. Apple versus China. So Apple has been looking to reduce its reliance on China for its product assembly, with India and Vietnam emerging as key locations. The Apple CEO Tim Cook arrived in Hanoi, Vietnam on Monday the 15th of April as the US tech giant is looking to boost investments in new markets.
Yeah, I think I think all of this is really fallout for the US war with China. It's kind of a silent war. I think all of this is a really interesting reflection of US's sort of like, I don't know if Cold War is the right, but trade war with China, and things like the jailing of the Huawei executive and sort of a raft of US initiatives to sort of create a gap between them and China. It's interesting to see how it plays out with companies like Apple, and I think we're going to see a lot more of this kind of continue to happen over sort of the next few years. On the social media side, LinkedIn is betting it can take on TikTok and Instagram in influencer marketing. According to reports last week, LinkedIn started letting advertisers promote posts from independent creators, gliding into the market of influencer marketing. This is coming to put a push towards revenue growth, as LinkedIn's revenue growth has been hovering below 10% since 2022.
Again, no real surprise there. The truth is, like, when it comes to content, you're fighting for relevance, that's the truth. And at some point, influencers is the way to move the market. So I guess it makes all the sense in the world that they're not going into influence.
I think it's been a big convergence of all the social media platforms on the same kind of initiatives.
Yeah.
And so,
Staying on the social media trend, WhatsApp has lowered its minimum age in Europe to 13. Meta has been roundly criticized in the past for its push to lower age restrictions across the platforms in the United States. The social media giant lowered the age requirement to use WhatsApp in Europe from 16 to 13, sparking criticisms from children's rights advocates. The new age restriction came into force in the European Union on Thursday.
Everyone's going to chase growth. They're going to chase growth whatever way it is they can get it. Moving on to AI regulation, the EU's parliament on Wednesday approved the world's first major set of regulatory ground rules to govern the mediatized artificial intelligence at the forefront of tech investment. Born in 2021, the EU AI Act divides the technology into categories of risk, ranging from unacceptable, which would see the technology banned, to high, medium, and low hazard. I think we're seeing a lot of this kind of regulation sort of starting to pay out, and the EU is always sort of ahead on the regulatory front. So super interesting. Moving on to the Africa scene, funding for African tech startups plunges by over 45%, according to Techabal Insight's State of Tech in Africa report for Q1. We've talked a little bit about this over the last couple of episodes. Definitely a tough period for the global tech ecosystem, and even tougher for Africa's tech ecosystem.
Yes, indeed. And then Ghanaian fintech startup Zippe has raised a round of equity investment, which will help support its expansions into its expansion efforts in Africa and to the Caribbean.
Yeah. I think it's encouraging to see, even in the midst of sort of like that funding decline, there's still a lot of companies doing interesting things and raising capital.
And expanding.
Yeah.
Stay tuned. That was the global headlines of Tech into the Future. We'll be right back. Welcome back to Tech into the Future, where today's focus will be on the impact of technology on the healthcare industry in Nigeria. Let me ask you, did you know that Africa's health tech industry was the only sector to see year-on-year growth in funding last year?
With a 7% increase. Yes, I knew that. I knew that.
All right, fantastic. Well, the tech startups in Africa and their challenges, limited medical workforce due to brain drain, supply chain fractures, and the landscape, regulatory landscape, as we know them.
Yeah, no, it's a challenging environment, but today's guest leads an innovative team that set out to curb the menace of counterfeit drugs and build a credible medical product supply chain in Nigeria. Remedial Health offers digital procurement and patient medication records, PMR platforms, that make it easier for neighborhood pharmacies, patent and proprietary medicine vendors, and hospitals to access affordable and authentic retail medicines. Welcome, Samuel Okwuada, CEO of Remedial Health. Welcome, Samuel.
Welcome, Samuel. So let's start off. Tell us, what inspired the initial idea to move back to Nigeria and start Remedial Health?
Okay, if I'm to tell that story, we'll probably stay here the whole day. But in summary, it was me wanting to do something back home. I studied pharmacy and worked in the UK for a bit. And I just knew that the problems that I wanted to solve were mostly back home. Everything in the UK is pretty much built. Someone had to do it a few, maybe 20, 30, 40 years ago. So I think this is the time for Nigeria to build some of those structures that will propel it into the future. So that was why I returned back home.
Fantastic. So what specific problems did you aim to solve?
Okay, so when I came back in 2015 to Nigeria, I started a pharmaceutical marketing business. So we're basically producing medicines in India, importing them into the country and selling in the market. And fast forward to COVID, right? There was a lockdown in Nigeria, a lockdown in Lagos especially. Within about 2 days of that lockdown, pharmacies and hospitals were running out of inventory to sell to patients. So I would typically sell in bulk, so 100 cartons, 200 cartons to one person. And here I was getting calls from pharmacies, getting calls from hospitals saying, hey, I would typically sell your anti-malarial but I don't have it anymore. And I had to just check online, the website, and I found your contact numbers. So I say I should reach out. And you supply this product to me. And I'm asking, how many packs do you need? And they say, oh, I just need 5 packs, or I just need 20 packs. At first, I was thinking, this is not the business that I want to do. I'm doing bulk sales, 100 cartons, 200 cartons, not 5 packs. But yeah, I got a few of those calls, probably about 7 within 2 days. And it was quite clear that there was a problem with our supply chain in Nigeria for pharmaceuticals. And simply, we have a disorganized supply chain for pharmaceuticals. We would typically sell medicines in open air markets in Onitsha, Lagos, that's the Idumota market, and in Kano. And this is where pharmacies and hospitals have to go in to buy the medicines that they need for patients. That poses a number of problems. Very quickly, one, the issue of counterfeit. So in Nigeria, our figure for counterfeits is 40%. What that means is 4 out of 10 packs of medicines you buy are probably counterfeit. That is a major problem. This harms people yearly or even leads to death. So that's one major problem that we're trying to solve with Remedial Health.
Fantastic. And then tell us, as an African health tech founder, what other problems have you encountered?
Oh, many. Again, that's another one that we can sit here till tomorrow discussing. But I would say taking the tech away, we're a pharmaceutical business. We're basically trading. We face the problems that every traditional business in Nigeria faces. So whether it's the issue of power, today we're probably spending upwards of 30, 40 million naira on some form of diesel or petrol every month. And that's because we just don't get the power that we need to be able to operate. The issue of bad roads and having to repair and fix trucks as often as we need to. Multiple taxation. So even when you've paid everything that you need to pay, you've bought all the paperwork that you need to pay for in a year to operate in a certain market. When your trucks are on the road, you still have people stopping them to say, hey, there is this paper for this, there is paper for that. That's also costing us millions every single year. So I would say we face normal problems that traditional businesses face if you take the tech away from it.
Interesting. I mean, and so these are definitely Africa-specific problems, not global standard problem.
Yes, correct. These are specific to Africa. In most cases, specific to Nigeria.
To Nigeria, to be, yeah. So tell us a little bit about your impact on the market. So what kind of metrics would allow our audience to understand what impact Remedial Health is having? How are you changing the market?
Okay, so today we just turned 2 last month. So 2 years in operation. We're currently about 450 people at Remedial Health today. We supply or service up to 9,000 pharmacies and hospitals today in Nigeria. We are pretty much in all 36 states of the Federation. So what that means is you can be a pharmacy in Ebonyi State or a pharmacy in Bayelsa or a hospital in Sokoto, and we will be able to get medicines to you within 2 days max. And we have a number of testimonials of pharmacies and especially pharmacies. I would say the owners who say, hey, Remedial pretty much changed my life. I used to travel maybe 3 or 4 hours to the market to do my procurement. And now I can just order and it comes directly to me. My bank, even after I've been with them for 3-4 years, would not extend any form of credit to me. And with Remedial Health, I'm able to access the credit that I need to scale my business. So there are a number of testimonials like that. And then even to the hospitals who use us for emergency medicine supply. So we get that probably up to 10, 15 every day. Usually, these are hospitals who probably have a patient on surgery bed who needs a medicine within the next 30 minutes to 1 hour and can place that order with Remedial, especially in Lagos, and get that product very quickly. So I would say the impact is not something that I can quantify because it's really human life at the end of the day. The estimate for Nigeria is that over 500,000 people die annually because they take counterfeit medicines. At Remedial last year, we sold over 100 million individual packs of medicines in Nigeria. These are 100% genuine medicines. So even if it's one life we've saved by supplying genuine medicines to someone who would have otherwise gotten the fake or the substandard, then I think you can begin to sort of imagine what that impact is. You can't really quantify it as is human life.
Very interesting. Thank you for that. So tell us, who would you consider to be your competitors and what are you doing differently from them? It's a bit of a compound question because I also want to ask, like, who was playing this role before Remedial Health came into play?
So the traditional way was these markets where you go to buy products. So anyone who has gone into any of the big markets in Lagos would tell you how rowdy, how dirty those places can be. Unfortunately, this is where we're also selling medicines. Medicines typically are not or should not be treated like plastic. They are affected by temperature, they are affected by humidity. So you could get anti-malarial, the traditional one that adults take, which is 480 milligrams. And by the time it's actually getting into a patient's mouth, it's probably 400, right? It has lost some level of efficacy just because of the way it was handled, because of the way it was stored. If you take a tablet and put it in a cup and just shake it vigorously, bring it out after probably a few seconds, you see some powder left in there because these are basically powder molded into a tablet.
Right.
Now, the traditional way, I would say, is our main competition and still remains the main competition till date because those markets still exist. But we're glad that at least for the 9,000 pharmacies and hospitals who use Remedial today, they are able to, one, be sure that we're getting medicines that are 100% genuine. Two, we're getting medicines that have been handled correctly from supplier or from manufacturer directly to my store. And then three, they can also get credit whilst at it so that they're able to scale their businesses faster.
Fantastic. I think that's really important impact that you've kind of described in there. What's new and what's next from you on the innovation front? New products, new launches? Yeah.
So we just announced an upgrade to our app, which we provide to these customers, so the pharmacies, the hospitals. For the past 2 years, we've basically just provided them a service where they are able to order the medicines they require. So think the way you can order electronics on Jumia or something on Amazon. So these pharmacies and hospitals can just place orders for what they need and get it delivered. That's been the traditional service that we've offered. And what we just announced is an upgrade to that app that allows them to also manage their businesses. So if you speak to a pharmacist today, one of the biggest problems that they will tell you they have is when they do their P&L, maybe at the end of the month or at the end of the year, they have to also account for expiries, for example, right? Because a traditional pharmacy, if you walk into a pharmacy today, you will probably see over 1,000 products on their shelves. It's difficult to know exactly what is on your shelf. It's difficult to track the expiry dates of what is on your shelf. It's also difficult to track the batch numbers. So just last week, NAFDAC recalled a cough mixture. And for your regular pharmacy, they would have to really look around the pharmacy to try and figure out, hey, do we have this product on our shelf? Now, with what we've built for them, they're able to, one, handle sales, take payments from their customers, record their expenses and see how well their business is doing at any given time. Even if you're running multiple businesses, that's multiple stores, you are able to run your multiple stores from your phone or from a tablet by seeing the performance of each store. You can give sort of access levels to different employees within your organization. And then, yes, you can also see what is expiring on my shelf. What do I need to get rid of before it becomes a negative on my P&L? That is typically a very big issue for them. So that's a new product that we're launching. And we've had, I would say, very, very, very excellent reviews so far. So yeah, we're just upgrading our customers to the new product and also pushing out so others can learn of the benefits of using software like that to manage their operations.
Fantastic. Tell us, funding-wise, how have you raised, funding-wise, you have raised pre-seed, seed, and recently a Series A round. Tell us what guided the decision to opt for a mix of equity and debt funding last year.
Okay, so earlier in the interview, I think I mentioned if you take the tech away, I think that's my typical advice to most people doing business in Nigeria who want to do tech startups. I usually say, hey, first things first, you're a tech startup. Yeah, I agree with you. Keep the tech aside. You have real problems to solve in the market. So in our case, we are a trading business. We buy and we sell. We have a number of suppliers, over 200 today. These are local manufacturers. These are people who also import into the country that we buy from, hold in our warehouse, and then sell to customers, these pharmacies and hospitals. So what it means is you need some sort of working capital. Now, equity is expensive. I think we can all agree that having to give away a chunk of the business each time you need money is quite expensive. And if you can do debt, on the other hand, that's more sustainable in the long run. For a business like ours as well, for each stage of growth, you sort of need more money. So what that means is if you keep raising equity each time you need to grow, before you know it, you are probably left with 5 or less than 5% of the business.
Right.
So that is the more reasonable route to go in instances like that.
Thanks so much for joining us today, Samuel. It's been a fascinating conversation. Don't go anywhere. This is Tech into the Future on Arise News.
Welcome back to Tech into the Future, where we just had quite an interesting interview with Remedial Health, the COO of Remedial Health, and the co-founder, actually, of Remedial Health. It was quite interesting. I think one of the things I appreciated that he says, I take the tech away, right? We're a business. And I think the fundamental thing is there is a gap, and all I'm trying to do is bridge that gap. And the only way I know how, with my pharmaceutical background, is to leverage technology to get this thing done, right? Build a business where it's easier to, like you said, make sure we're not, we can track counterfeit goods. We make sure that, well, first of all, make sure we don't have counterfeit goods, making sure we're able to track and supply medicine. I think it's also interesting, right? When we're talking about how do we measure, we're such a tech people, so we're always looking for data. Also interesting, when he talks about saving one life,
ultimately, like this business it's not. Yeah, there's the financial returns, and there's the big numbers. We sold 100 million packs, but ultimately, I mean, you are in medicine. You're saving lives. I think there's a point you kind of started to allude to there, which is you're running a business in Nigeria, you're running a business in Africa. Once you take away the tech, there's a mystique around tech businesses. They've raised so much money. They've, they operate in this rarefied tech world. But I think his point around sort of the realities of running a business in Africa, are always there. It's expensive to run your diesel,
energy,
like
trucks,
logistics, regulators, taxation.
Yes, exactly.
So you're still facing all of those. You're facing all of those risks. You're facing all of those challenges, and then you have what's called technology risk, which is, will this tech that you've developed, will it work? Will this business innovation, this new model, will it work? And so you have those risks on top of all of the standard risks of running a business in Nigeria or in Africa. So that's definitely an interesting challenge, and I like his advice to tech founders, which is, as you're thinking about the business, you're thinking about the realities of operating in this environment. Quite critical.
Yes, and I like even what he said about the funding, right? It's like, listen, at the end of the day, when you put your heart and soul into something, you're now very mindful of debt financing versus equity, because, I guess the fear is that, I'm trying to raise money just so I can keep this thing afloat, but I certainly now don't want to lose it.
Get diluted to the point where eventually when you make the big exits, there's nothing left for you because you sold it all to find money to run the business.
But what I find interesting is that there's no one else in this space. I mean, according to him, right, if his competitors are just the traditional way that, we've been going about procuring medicine, and that's interesting that there's nobody else.
I think that's there. I mean, there are, every founder and every business leader will position themselves as the only ones in the space. I think there's a number of pharmaceutical plays which might not be exactly the same model, but which are doing supply chain businesses for pharmaceuticals, which are thinking about how to sort of like improve the supply chain management, the ordering of goods, preventing counterfeiting. So there's a number of kind of players in that space. And I think a little bit similar to the fintech space, there's also a little bit of everybody edging into other people's plays. So people start out, doing medical records, start to offer credit, and then eventually starts to offer sort of like supply chain support, or people start out supplying pharmacies and then end up sort of moving into securing of the goods and making sure they're not counterfeit as well. So there is, I think, there might be the only one that started from that exact angle, but you'll see that there is some duplication of function across sort of some competitors.
And there are a lot of people, maybe not a lot, but there are quite a few people, like you said, few players that are doing it on the back end. So I think maybe to his point, he's probably talking about front end with an app, etc. But there are quite a lot of the big chains that are using technology for their supply chain management of medicines, etc. So, but it's still an interesting space to keep watching, because I think, like you mentioned, with fintech, at some point they will all come to the fore.
There's a convergence.
Right? Exactly, there's a convergence, and that will be interesting to watch, especially as we are going to be the recipients of their innovation.
Yeah.
Thank you for joining us on Tech into the Future today. My name is Ngozi Madra-Kadozie.
And I'm Tomiwa Ladikomo. Join us next time as we take you into the business and impact of tech in Africa, how it's changing the world and how it's changing your world. Stay tuned to Arise News.